Good afternoon, everyone. This is a 2-year outcome study of mini-open Trans-foraminal Lumbar Interbody Fusion study. Lumbar interbody fusion is a choice of procedure for lumbar disc pathologies and spondylolisthesis and any other past defect. And minimally invasive TLIF is the most, let's say, trending procedure these days for this kind of a pathology. However, wherein in case of MIS TLIF, we use a percutaneous screws using either image-guided C-arm or navigation method for inserting the screws. Now this involves a lot of pre-operative as well as intraoperative radiation, not only for the patient but also for the doctor and the OT staff. So this mini open TLIF technique involves using a retractor blade system for achieving the interbody fusion in a through a transforaminal approach. However, the screws are inserted using a regular conventional open method, wherein the screws are inserted through by visualizing the mammillary body or through the Mercedes technique. This leads to a reduction in the intraoperative radiation exposure to the patient as well as to the staff. So in this technique, the mass quadrant system was used by Medtronic, wherein the TLIF was done through the side through which at which the patient had maximum pain. A 3 centimeter long paramedian incision was used. TLIF was done using local bone graft with or without TCB, and a PEEK or a titanium cage was used. The screws were inserted through the expandable retractor system itself by visualizing the entry point directly through with your eyes. Contralateral screws were also inserted by taking a paramedian incision and the entry points being visualized with your eyes. The contralateral side facet fusion is also achieved through the other contralateral incision. This is the image that we get to see. Now, if you see in the red circle, the number of shoots that were taken to achieve this procedure, if it is at all visible over here, it is just 9 shoots. Whereas in case of MIS TLIF, the number of shoots that are required are significantly higher, not to mention the radiological exposure. If you can see the incision size is as much as a MIS TLIF itself, and the Medtronic retractor system is used on both the side. The patients were discharged and they were comfortable upon discharge with minimal pain. They were followed for 2 years minimum. X-ray was done immediately post-op at 6 weeks, 4.5 months, 1 year, and 2 years. The pre-op and the post-op data was collected in terms of patient-reported outcome measures, ODI and VAS. Any untoward event or adverse event was recorded during the perioperative phase. So the results are such that 137 patients were studied in this particular study. 88 were males, 49 females, ranging between the age of 18 to 78. The average surgical time was 103 minutes, and the blood loss was 80 cc, the range being around 50 to 150 ml. The fluoroscopic exposure was 7 shoots, ranging from 5 to 12. These are the number of shoots. Discharge was between 1 to 3 days, median being 2. There was a case of 1 dural tear, which was eventually converted to an open surgery. There were 2 cases of superficial wound infection, which were both debrided on post-op day 7 and were eventually discharged disease-free. 10 patients had contralateral leg pain, which resolved completely without any intervention in the next 3 months. Only 2 required a CT scan to check the screw. However, there was no malpositioning or there was no requirement for any implant revision. 2 patients had radiographic loosening of S1. However, there was no significant symptoms, so they were left alone. These are the patient-related outcome measures preoperatively and on the last follow-up.
Please conclude.
Yes, sir. So the discussion is such that this is one of the largest mini open TLIF studies, and there were multiple papers previously by multiple authors which propagated mini open TLIF procedure, which all concluded that there is significant reduction in the pre-op as well as intra-op radiation exposure to the surgeon as well as to the patient. In this case, the routine solid screws can be inserted using using a very familiar technique which all surgeons are very familiar with. So it reduces the learning curve. Plus, the contralateral facet is also fused, which adds stability to the entire construct. Thus, we can conclude that the radiation exposure is significant in case of MIS TLIF, which is reduced significantly in a mini open. It's a safe and reliable technique, a tried and tested technique, and the learning curve also reduces compared to an MIS procedure. Thank you.